Hi there. Did you know that 1 in 10 women are diagnosed with endometriosis? Today, I'm starting a mini-series that focuses on endometriosis, what it is, where it comes from, how to get diagnosed, and how to get relief from it. And I want to talk to you also about the causes of endometriosis, the history of endometriosis, common symptoms of endo, and what you can do to get relief at home. Hi, I'm Dr. Gina Terranoni from Holistic Health Journeys for Women. I've helped over 2,000 women and couples to get pregnant and have healthy babies over the past 22 or so years. I've also helped and supported several thousand other women through pregnancies, postpartum, perimenopause, menopause, all with holistic and functional medicine. And I focus on quick action tips based on research, decades of training, and my clinical practice. And please, if you find value in this video, please subscribe to my YouTube channel, and then also definitely check the show notes for free resources that can help you to get pregnant even if you have endometriosis. And stay until the end because I will add in bonus material on how to deal with getting rid of endometriosis pain. Okay, let's get started. So, what is endometriosis? Where did it come from? These are all the questions I'd like to answer over the next few videos. So again, definitely subscribe. Endometriosis has been around for about 100 years, yet there is no simple, non-invasive diagnostic tool to diagnose it. So 1 in 10 women are diagnosed with endometriosis, but the number is probably much higher. This is because many women are misdiagnosed with IBS or PID and treated for these issues instead. It's very misunderstood health concern in Western medicine, so it's crucial that in addition to asking for a specific diagnostic tool from Western medicine, that you actually integrate and look at a more holistic and functional medicine approach, especially to help you to get relief from it. So think about it this way. It's important to monitor endometriosis with Western medicine, but we treat with holistic medicine. And I'll get into more details about that. So this way, integrative medicine approaches, they're super helpful for women who have endometriosis. And the nice thing about monitoring endometriosis is that you can actually track the progress of what's the status of your endometrial tissue. You'll see improvements regarding reduction in the lesions, maybe the location, maybe there's smaller size. They start to shrink down after holistic or functional treatment. There's a less pain level, which is obviously one of the most important things. And then also less regrowth in other areas. So what is endometriosis? Well, endometriosis is the presence of endometrial tissue of the uterine cavity. It's commonly associated with chronic pelvic pain and infertility. It's a complex syndrome characterized by an estrogen-dependent chronic inflammatory process that affects primarily pelvic tissue, including the ovaries. But it has been found outside of this area as well. In fact, a client that I've spoke with recently has endometrial tissue on the other side of their belly button area. And it is caused when shed endometrial tissue travels retrograde into the lower abdominal cavity. Endometriosis is the most common cause of chronic pelvic pain in women and associated with infertility. In fact, a number of patients and clients that I've worked with, there's like varying degrees of pain levels, and some of them haven't even been diagnosed until they get diagnosed with infertility. Again, it's the most common cause of chronic pelvic pain. The endometrial tissue found outside of the uterus responds to hormones just like regular endometrial tissue inside the uterus. So that's why it's so painful. It goes through cycles of like building up, maturing, then sloughing off and bleeding. But where the pain really comes in is when that tissue is accompanied by inflammation, and the repetition of this process in the wrong location may eventually cause scar tissue. And then these lesions start to build up in the area. And it's quite painful. And if you have endometriosis, you know this, my heart goes out to you. These lesions start to contract and expand. And sometimes the endometrial lesions go away and then they start up in a brand new area. It's very difficult to predict where the lesions will start to grow and where they'll turn up again. So what causes endometriosis? Well, there's a few ideas, but nothing too certain or specific. So clearly there needs to be a lot more research And the good news is that there's more of a spotlight coming around endometriosis, and that's why I'm really involved with helping patients to get a voice so they can ask for more help. There's a few ideas. According to Western medicine, it's an inflammatory disease, and some say it can be caused by your genetics. It's possible that it runs in women in the family. Possibly early signs of endometriosis or possible causes of it can result as early as, when women have early period. So say if a woman or a girl starts her period less than 12 years old, shorter menstrual cycles that are less than 26 days. So that means there's more bleeding happening as opposed to somebody who has a cycle for 28, 30, or 35 or more. A woman who experiences heavy bleeding, extended bleeding that lasts more than 7 days, IUD use, DNC history, and less than 2 pregnancies. So these are all things that can contribute to having endometriosis. The inflammation piece of endometriosis is related to the immune system. So technically, endometriosis is not considered an autoimmune disease by everyone in the medical field, but surely it resembles autoimmune disease with the presence of autoantibodies. Often women with endometriosis will experience inflammation and health issues in other areas of the body. And this is one reason why it's so difficult to diagnose and treat. And in addition to what may actually cause endometriosis according to Western medicine, let's look at it from a holistic perspective. And also my training's in Chinese medicine, so I want to give you that perspective as well. So first, who gets endometriosis? It occurs in young women of childbearing age. This makes it really difficult because of the pain and dealing with the discomfort. That can really make it a challenge for becoming pregnant. And oftentimes it's misdiagnosed again as irritable bowel syndrome or IBS because the symptoms then cross over with both endometriosis and IBS. And let's talk a little bit about the history. So endometriosis first was diagnosed in 1860 and officially named endometriosis in the 1920s. It affects, like I said, 1 in 10 women, so 10% of women. And these numbers are when it's diagnosed properly, if at. As far as women experiencing infertility, roughly 38% of women are diagnosed with infertility due to endometriosis complications. And again, this is definitely an area of women's healthcare that needs a lot more attention and a lot more research. I'm here to fill that void for you. A little side note here. This is the number one thing that patients say. My doctor thinks I'm crazy. They're telling me it's not a big deal. It's going to go away. And they don't even bother testing or diagnosing that. We need to work on this. What are the actual symptoms? Well, if you have it, you know some of the symptoms, but let's talk about them because some people don't have, there's like 0 to 10 on the pain scale. So maybe they got a 2 or 3 and they're like, oh, I don't know. Not sure, but here, let's go over the symptoms. So they can range from minimal symptoms to excruciating and debilitating symptoms, which is horrible. It's absolutely horrible. And I work with women all the time in lessening the pain and alleviating it. So you'll see some internal bleeding, scar tissue, and debilitating chronic pain. Pain during periods, pain between periods. This is a big one. Pain with intercourse or sex is so uncomfortable. And sometimes my patients will often tell me that just arousal will really cause them a lot of pain. And then, of course, you have to look at the relationship with their partners and the dynamics of that and just the understanding. It causes a lot of problems for women. And also you can have pain with bowel movements, again, being diagnosed with infertility. And again, a lot of times that's when women find out that they have endometriosis when they're not able to get pregnant. You may also feel fatigue, exhaustion, constipation, lower back pain, headaches, dizziness, nausea, upset stomach, heavy bleeding, and anemia, which again, some of these symptoms are under other diagnoses, so it can be a little bit tricky. And then lastly, bloating and swelling in the abdominal area, otherwise known as endobelly. It literally can look for someone, they're like, oh my gosh, I look like I'm 5 or 6 or more months pregnant after they eat. Or just in general, they're kind of walking around and they're always wearing baggy or stretchy clothes because it's so uncomfortable. So how is it diagnosed? How do we diagnose endometriosis? Well, with Western medicine, generally it's diagnosed with a pelvic exam, ultrasound, MRI, but the best is a laparoscopy. Often it gets missed with some of the other tests. So if we look at Chinese medicine and we focus more on patient-centered care, understand how endometriosis is impacting the patient's life and body, and we look for the root cause of the disease. So often this is even more important than learning the symptoms and treating the symptoms. Many times, the cause or the root of the disease is treated the same as the symptoms and acute discomfort. So we do treat according to different types of endometriosis as we diagnose them in Chinese medicine. So that's really important to know, that we can break it down into little niche categories, and then you'll get a much more effective treatment. So the main cause of endometriosis that we find in Chinese medicine is called blood stasis. Now, what blood stasis is, this is a stuck or stagnant nodule or a lesion that builds up due to an issue with inflammation and circulation, as well as hormone imbalances and lifestyle factors. So if you've ever seen a Chinese medical doctor for endometriosis, are you fatigued? Do you have sharp pain? Is the pain local? Where is it? Does the pain move around your body? Do you have relief with warmth or with a cold pain? Are you irritated with eating food? Is it worse when you're hungry? And so many more questions. And similar to Chinese medicine, functional medicine looks at the patient holistically as well. So just like Chinese medicine, it takes the whole women's medical history into account and checks areas throughout the body and systems that are causing or contributing to overall sickness and health. Okay, so here's a little bonus material. How do we get rid of endometriosis pain? Well, here's a couple of tips that I want to get to much more detail in the series in the next video. But to get started, these are things that I hear that are common with women that experience pain. So I want to point these out for you. Do your best to try and not use tampons ever during your cycle. It really blocks the flow of blood and it can create cramping, and your body's kind of resisting and just it's just like an ongoing battle inside. And you probably noticed that. If you switch over to pads, or now they have period underwear, and I know that can be heavy flow, so you can double up, use the period underwear with pads. That's a good idea. But at least if you're home, use pads and don't use tampons. Don't sleep with tampons. And there's other ways that you can prep to support yourself so you don't have to experience any of the mess. Also, it's important to drink fresh ginger tea. So I don't really like the bag ginger tea because, first of all, I don't like the taste of it, but it's not as strong. And so you can grind up, buy the little ginger root at the grocery store in the produce section, grind it up, make sure it's organic, grind it up, and you can add in fresh turmeric, which looks very similar to ginger, but it's got like a little orange or kind of a peach color, a little bit darker than ginger. And you can grind both of those up and then pour some boiling water over them and steep it for about 5 minutes and sip on that. But I also recommend drinking at least fresh ginger tea before eating any meals, but throughout the day, especially if you've got acute pain occurring. And then also, if you're familiar with doing yoga, child's pose is an excellent pose, and I'll be adding in more in the other videos. But this is a great pose. I can put a link, or I can do a diagram or something for you in the show notes, but go into that pose and focus on deep belly breathing. This really helps with menstrual cramps and also the stress that comes along with the pain and the frustration. So give that a try. So after this video, we've got a better understanding of the issues that we have with diagnosing, misdiagnosing, or just completely, maybe you've experienced completely getting blown off by your doctor, which is completely unacceptable. And there is the lack of proper diagnostics and trackable tools. However, I hope that you can see now that if you add in integration like holistic medicine, functional medicine with Western medicine, this can offer strong considerations for diagnosing, but also treating with no side effects. So I do encourage you to track your cycles and symptoms starting today. So if you think you may be showing signs of endometriosis, that is the best way, because when you go to see a holistic practitioner or Western doctor, then you can tell them exactly what's going on, what day of the month. And there's a lot of different ways to track, and I will be offering some journal information for that as well. In the next episode, we're going to look at how endometriosis is treated and see what treatment options are available to you if you do have endometriosis or symptoms. So I really appreciate you. Thank you so much for tuning in today. Don't forget to subscribe so you find out about the next video release. And then definitely download a free copy of how to get pregnant with endometriosis.